All right, sweetie, let's get you up here. Good boy, you're doing great.
It's 1 a.m. The house is dead quiet, and then you hear it lap, 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 lap. You open one eye. Your dog is back at the water bowl again, third time tonight. You smile a little, half asleep, and think, good, at least they're drinking. But here's what nobody tells you. That sound, that one small, almost cute little habit, can be the very first sign your dog's body is trying to tell you something is seriously wrong. Not next week, not eventually, tonight. If you've noticed your dog suddenly drinking more than usual, some part of you already knows something feels off, and that instinct is exactly why you clicked on this video. So stay with me, because in the next few minutes, I'm going to show you the real hidden causes behind sudden excessive thirst, how to tell the difference between it's just hot outside and a genuine emergency, and exactly what to do about it starting tonight. Hi everyone, I'm Dr. Naomi, your neighborhood veterinarian, and welcome back to the channel. Let's talk about the myth first, because I hear it in my clinic almost every single week. An owner brings their dog in, and I ask how long the increased drinking has been going on, and the answer is almost always the same. They figured it was the weather, or that their dog has always been a big water drinker. My friends, being a big water drinker is not a real diagnosis. It is a comfortable story we tell ourselves so we don't have to think about the scarier alternative. And I understand why. Nobody wants to imagine their healthy, happy dog could be sick. But increased thirst, what we call polydipsia in veterinary medicine, is one of the most reliable early warning signs in the entire body. The kidneys, the liver, the pancreas, even the uterus, they cannot scream. They cannot tell you they are struggling. The only language they have is symptoms like this one. So tonight, we are going to learn to actually listen. Before we get into the scary stuff, I want to arm you with a simple piece of math because this is the exact tool I use in my own clinic to separate normal thirst from a red flag. A healthy dog should drink, on average, about 1 ounce of water per pound of body weight per day. So if you have a 30-pound dog, that's roughly 30 ounces, or just under 4 cups, across an entire 24-hour period. If your dog is suddenly drinking double that, or you are refilling the water bowl 2 or 3 times a day when you used to fill it once, that is not just being a big water drinker. That is your dog's body sending up a flare. Tonight, I want you to actually measure it. Fill the bowl to a specific line, write down the time, and check it again in the morning. Do not guess. Vague observations lead to vague answers, and your dog deserves better than a guess. Now let's walk through the hidden causes I see most often in my clinic, starting with the one that catches owners completely off guard. The first is diabetes mellitus. I once had an owner bring in her 10-year-old beagle named Daisy. Daisy was, in the owner's words, eating like a horse and somehow losing weight. And on top of that, Daisy was drinking water constantly and having accidents in the house, which she had never done before in her life. The owner assumed it was just old age catching up with her. It wasn't old age. It was diabetes. Here's the science behind it, and I promise to keep this simple. When a dog develops diabetes, their body either stops producing enough insulin or stops responding to it properly. Insulin's job is to escort sugar out of the bloodstream and into the body's cells, where it's used for energy. Without enough insulin, sugar builds up in the blood to dangerously high levels. Eventually, that excess sugar starts spilling out through the kidneys and into the urine. And sugar is what we call osmotically active, which is a fancy way of saying it physically drags water along with it. The kidneys end up flushing out far more water than normal, which means your dog is urinating constantly, which means they have to drink constantly just to keep up. It becomes a vicious, exhausting cycle, all happening silently inside their body while you're just refilling a water bowl. The correct way to catch this early is to watch for the combination, not just one symptom in isolation. Increased thirst paired with increased urination, paired with weight loss despite a normal or even increased appetite, is the classic diabetic triangle. Some owners also notice their dog's urine has a faint sweet smell, almost like it's been left out, because of all that extra sugar. If you notice this pattern, your vet will run a simple blood and urine glucose test, and in most cases, we can have an answer within the hour. Diabetes is absolutely manageable with daily insulin injections and diet changes. Dogs live long, full, happy lives with it. But left untreated, it can progress into a life-threatening condition called diabetic ketoacidosis. If your dog is drinking excessively and also seems lethargic, is vomiting, or has noticeably bad breath that smells almost like nail polish remover, that is not a let's wait and see situation. That is an emergency vet visit tonight. The second hidden cause is chronic kidney disease, and this one breaks my heart every single time because by the time most owners notice it, the kidneys have often already lost a significant portion of their function. I had an elderly golden retriever named Bear come into my clinic. His owner assumed he was just drinking more because he was getting older. We ran blood work, and Bear's kidney values were elevated. He was in the early stages of chronic kidney disease. Here's what's actually happening. Your dog's kidneys have one incredibly important job. They filter waste out of the blood and concentrate urine so the body doesn't lose more water than it needs to. When the kidneys start to fail, even partially, they lose the ability to concentrate that urine properly. Imagine trying to squeeze a sponge that's already nearly dry. You're not getting much out of it. A failing kidney is the opposite problem. It's like a sponge that can't hold on to water at all anymore. Dilute, watery urine pours out constantly, and the body compensates the only way it knows how, by making your dog desperately thirsty to replace what's being lost. The correct way to catch this early is exactly why I recommend annual blood work for every dog over the age of 7, even if they look perfectly healthy. We specifically look at 2 values, BUN and creatinine, and ideally a newer, more sensitive marker called SDMA, which can detect kidney decline months or even years before traditional blood work would. Other signs to watch for, alongside the thirst, include slightly less interest in food, occasional vomiting, and a coat that looks dull or unkempt. And please, never restrict water from a dog you suspect has kidney issues. I know it sounds backwards, but cutting off their water supply because they're drinking too much can actually cause a dangerous dehydration crisis on top of the kidney problem. Always let them drink freely and get them to your vet for blood work instead. The third hidden cause is Cushing's disease. And this one is sneaky because the early signs often get blamed on something completely harmless, like getting older or gaining a little holiday weight. I had a client come in with her 10-year-old dachshund, worried that her dog had suddenly developed a potbelly and was panting constantly, even in a cool, air-conditioned house. Combined with that non-stop water drinking, this was a textbook case of Cushing's disease. Cushing's disease happens when the body produces too much cortisol, which is the primary stress hormone. Sometimes this is caused by a small tumor on the pituitary gland in the brain, and sometimes by a tumor on the adrenal gland itself. Either way, the body becomes flooded with cortisol around the clock. Cortisol directly interferes with the hormone that normally tells the kidneys to conserve water, so the kidneys end up producing far more urine than they should, and once again, your dog drinks excessively just to keep up. The correct way to spot it is to look for the full picture alongside the thirst. A pot-bellied appearance, even in a dog that isn't overweight, thinning hair or bald patches, especially along the trunk, skin that looks thin or bruises easily, and heavy panting even when it's not hot out. If you notice several of these together, mention all of them to your vet, because Cushing's disease is confirmed with a specific blood test called an ACTH stimulation test, not just a standard wellness panel. Cushing's disease develops slowly, sometimes over a year or more, which is exactly why it gets missed. Don't dismiss a slowly changing body shape as just getting older and lazier. Take photos of your dog every few months. It's the easiest way to catch subtle physical changes that are nearly impossible to notice day to day when you're looking at them constantly. The fourth cause is one I need every single person watching this with an intact, unspayed female dog to lean in close for, because this is genuinely one of the most dangerous conditions I treat. It's called pyometra. I had a sweet 7-year-old unspayed boxer come in who had suddenly started drinking enormous amounts of water and seemed lethargic. Her owner mentioned she'd had her last heat cycle about 6 weeks earlier. That detail was the key. An ultrasound confirmed pyometra, a severe infection of the uterus, and we were in emergency surgery within the hour. Here's what happens. After a heat cycle, hormonal changes can cause the lining of the uterus to thicken in preparation for a pregnancy that doesn't happen. Over time, and especially after repeated cycles without pregnancy, that thickened lining becomes the perfect breeding ground for bacteria. The uterus fills with infection and pus. The toxins from that infection affect the kidney's ability to concentrate urine, triggering exactly the same excessive thirst and urination we've talked about already. The terrifying part is that pyometra can be what we call closed, meaning there's no discharge for you to notice from the outside. So increased thirst combined with lethargy might be the only warning sign you get. If you have an unspayed female dog and she is drinking excessively within roughly 4 to 8 weeks after her last heat cycle, do not wait until morning. This is one of the few true middle-of-the-night emergencies on this entire list because pyometra can become life-threatening within 24 to 48 hours if the infected uterus ruptures. This is also, candidly, one of the strongest arguments for spaying your female dog if she is not being used for responsible, intentional breeding. Spaying completely removes the risk of pyometra, permanently. Before we move to the action plan, I want to quickly cover 2 more causes because I don't want anyone watching this to feel like they've gotten the all clear just because their dog doesn't fit perfectly into one of the boxes we just covered. The 5th cause is liver disease. The liver is one of the most resilient organs in your dog's body. It can lose a huge percentage of its function before you ever see an obvious symptom. I had a middle-aged Labrador named Cooper come in whose only complaint from the owner was that he was drinking a ton and that his eyes looked a little yellow lately, which she had assumed was just the lighting in her house. It was not the lighting. Cooper's liver enzymes were significantly elevated, and that yellow tint was early jaundice. The liver helps regulate so many of the body's hormones and toxins that when it starts to struggle, fluid balance is often one of the very first systems to show it. There's also a second, much simpler explanation that I see all the time, and it has nothing to do with disease at all. Certain medications cause increased thirst as a direct side effect. Steroids, which are commonly prescribed for allergies, itching, or inflammation, are notorious for this. Some seizure medications and diuretics can cause it too. The correct way to handle this one is simple. Before you assume the worst, pull out the bottle and actually read what you're giving your dog, or call your vet's office and ask if increased thirst is a known side effect of anything currently prescribed. Sometimes the scariest looking symptom has the most boring, harmless explanation in the world, sitting right there in your medicine cabinet. Just please, never stop a prescribed medication on your own without talking to your vet first, even if you suspect it's causing the thirst. Some medications, especially steroids, can cause serious complications if stopped abruptly. Always call and ask before you change anything. Now that we've walked through these hidden causes, let's talk about your action plan, because information without action just leaves you anxious at 1 in the morning scrolling the internet. The first thing to do tonight is measure the actual water intake. Use a measuring cup, fill the bowl to a marked line, and track it for 24 hours. Don't rely on memory, write it down. Next, check the supporting symptoms. Has there been any change in appetite, weight, energy level, or urination frequency? Have you noticed accidents in the house from a previously house-trained dog? Write all of it down in your phone's notes app so you have it ready for your vet, because these small details genuinely change how quickly we land on the right diagnosis. Then check their gums and look at their urine color. Healthy gums should be a bubblegum pink. Pale, white, or tacky and dry gums are a sign of dehydration or shock and warrant an immediate emergency visit. Urine that is extremely pale and diluted, almost like water, paired with excessive drinking, points toward kidney or hormonal causes. Urine that looks orange or has a strong sweet smell can point toward diabetes. After that, call your vet, even if it's just for advice over the phone. You do not need to self-diagnose using a video on the internet, including this one. My goal today wasn't to make you a veterinarian. It was to make you an informed advocate who knows which questions to ask and which details actually matter. And finally, know your emergency triggers. If the excessive thirst is paired with vomiting, lethargy, pale gums, a swollen abdomen, or your dog is an unspayed female within weeks of her last heat cycle, that combination means emergency vet. Tonight, not tomorrow morning. I know this video covered a lot of frightening possibilities, and I know that's not always comfortable to sit through. But here is the truth I want you to walk away with. Most of the time, when owners measure the water intake and bring detailed notes to their vet, we catch these conditions early, while they are still highly treatable and sometimes even completely reversible. The dogs who do the worst are not the ones whose owners brought them in too early. They're the ones whose owners waited, assuming it was nothing, until the body simply couldn't compensate anymore. So here's my challenge to you. You don't need to panic tonight, and you don't need to rush to the emergency room based on one video. Just measure the water bowl tonight and check it again tomorrow. That's it. That single piece of data will tell you almost everything you need to know about whether this is nothing or whether it's something worth a phone call to your vet this week. Has your dog's drinking suddenly changed? Tell me in the comments below, how much are they drinking? And have you noticed any of the other symptoms we talked about today? I read every single comment, and if I can point you in the right direction, I genuinely want to. If this video gave you that little jolt of needing to pay closer attention, please hit the like button. It helps this information reach other pet parents who need to hear it just as much as you did tonight. And subscribe so you never miss the next masterclass. Give your dog a gentle scratch behind the ears for Dr. Naomi. Stay safe, always trust your instincts, and I will see you all in the very next video.